Do people experiencing homelessness have equitable access to primary care?
So the answer is no. People experiencing homelessness clearly do not have equitable access to health care, primary care. If we define equity by almost any means, but on any terms, but certainly if you think about those who have the greatest need should have the greatest access. Um, I think that that's true for a number of reasons. I mean, I think there's a number of just impediments or barriers to obtaining primary care, such as competing priorities, the need to seek shelter or food or other basic necessities, which therefore make seeking primary care less a priority for people. Certainly, there are barriers, huge barriers in terms of transportation, just getting to a primary care appointment. There's barriers in terms of I think like making appointments, so just things that we take for granted, like calling an office, leaving a voicemail and asking to be called back, or booking an appointment online are all significant barriers. Um, Certainly, there are barriers in terms of care-seeking behavior. We do see people who, because of, for various reasons, are of care avoidant and therefore are really require an outreach-based approach. And so in order to get them equitable access to care, we need to proactively engage with them and kind of go to where they are to provide care. Um, and certainly there's barriers in terms of people's experiences with the healthcare system. But there are people who have both very positive and very negative experiences, but certainly the negative experiences tend to be very off-putting and cause people to be reluctant to seek care in the future. And that's certainly an issue where many people have stories about how they were treated. They experienced care that they felt was suboptimal, or where they felt they were treated badly or in a frankly discriminatory way because of who they were, because of their homelessness, or often just their low socioeconomic status. So those are really key issues. I think that the whole healthcare system in general, of the primary care system, makes it easier to deliver care to people that are well and well off. And in fact, I think it makes it more remunerative to do so. So there's financial incentives to run a practice where people are, you know, they're there for a quick 5-minute checkup, and they have no complex health problems, and that actually is I think creates incentives to the healthcare system and to care providers to, I think, essentially provide care for those who are least maybe who are least disadvantaged or least in need.